Hi, everyone. I'm Dr. Bhama. I'm a facial plastic and reconstructive surgeon in the Seattle area. I'm also a photographer and run a photography company in my spare time. And in medicine nowadays, outcome assessment is a very important topic. By analyzing outcomes, healthcare systems can identify problem areas which can be improved upon and help standardize practices across different geographic regions. In facial plastic surgery, one of our most important methods of outcome assessment relies on photography. For instance, if I perform a rhinoplasty on a patient, I'm going to look at several outcomes. Number one, first, I want to know if the patient is happy with the result overall. Second, I'm going to see if the patient's breathing has improved. Third, I'm also typically going to administer a validated series of patient outcome measures, one being the nose scale. And finally, I'm going to look at the appearance of the nose and compare with the appearance before the procedure. And that's where photography can help us out. Photos create a static representation of a patient's face or nose or any part of the body before and after an intervention. And that can be really valuable for outcome assessment. In today's talk, I'll go over basic photographic concepts that can be applied to medical photography and equally well to landscape, wildlife, or portrait photography. And even if you're not an avid photographer, this talk can kind of help you understand basic concepts in photography that also apply when you take pictures with your smartphone. In this talk, I've got a bunch of photos from my practice and also photos that I've taken in my photography business and on vacations. This first photo is a picture of the galactic center of the Milky Way taken from Utah in Arches National Park. And this was taken probably a little bit after midnight. My daughter and I were waiting for the Milky Way to achieve this nice kind of angle behind this rock formation. And we'll talk exactly about how these pictures are taken later on. My disclosures are listed here. I own Bhama Photography and receive income through that LLC. This image is a bald eagle in Portage, Alaska. Here's a quick outline of what we'll chat about. We'll first talk about equipment very briefly, and then we'll touch on the importance of consistency in our photos. And that concept applies mostly to the medical photography side of things. And then we'll really get into the meat of the talk and discuss how we can alter the quality and quantity of light that enters our cameras. And again, this is really where anyone can benefit from listening in, because those concepts are applicable to all cameras and all types of photography. Specifically, we'll discuss the concepts of the exposure triangle, so to speak. Those include aperture, shutter speed, and ISO. And those are the three main parameters we can control to help adjust how much and what type of light enters our cameras. This photo here I took from Haleakala High Altitude Observatory site in Maui. And this is the galactic center of the Milky Way right here. And one of the observatories can be seen in the foreground. And this was taken probably around 2 a.m. I get a lot of questions from people regarding equipment. One of the most common questions people ask me is, what kind of camera do you shoot with? And I think that's a good question. I've used lots of different brands of cameras at various price points. But that question implies that the camera is doing most of the thinking. And I think that the equipment that one uses is important, but as Ansel Adams once said, the single most important component of a camera is the 12 inches behind it. And as such, I like to think of a camera as simply a light collecting device. You push a button, the shutter opens, the image sensor collects data from the light that enters the lens. And if you're shooting in JPEG, the camera or the phone will apply a set of algorithms to process that data into a condensed image. And if you're shooting in RAW, the data is left untouched for the photographer to process on his or her own. And that's a whole nother talk in and of itself. But the point is, you have to tell the camera exactly how you want the light to be captured. Your eyes, for instance, will constantly adjust to a particular scene based upon where in the scene you're looking. So that information then goes into your brain and gets processed by your occipital lobe, and your brain assigns an emotion to that image. A camera can't do all that. All a camera can do is open its shutter and capture light. And you may have experienced this concept before. I'm sure you've all been in a situation where you're in a beautiful spot and you're really enjoying the scenery, and you take out your phone or your camera and you snap a photograph. And when you look at that photo later on or show it to your friends, it doesn't seem like it does the scene justice. And you might say to your friends, well, it was way more beautiful in person. And that's because your camera can't do what your eyes and your brain do in real time. And so we'll talk about how we can instruct our camera to do what we want it to do. Here's a quick example of a photo taken at Horseshoe Bend, Arizona. This is a great example of how you have to really tell your camera what you want it to do. When I was standing here looking at this image, I looked at the sky, which was bright relative to the foreground, and my pupils constricted to allow less light in and preserve the details in the sky. And then when I looked down at the foreground, at the beautiful river and at the rock formations, my pupils dilated in real time to allow more light in. If I had taken this picture with a camera, it would have blended all the light data together, and the sky would have been overexposed and the foreground would have been underexposed, and I wouldn't have gathered all this detail. So we really have to, again, tell the camera what we want it to do. Let's spend a little bit of time talking about consistency before we talk about light. Again, this applies more to the medical aspect of our photos. And in our medical photos, we all want to demonstrate surgical changes. As such, it's really critical to optimize consistency in positioning and exposure between the pre and the post-op photos. It can be really distracting when the exposure in the pre-op picture differs from that in the post-op picture. Ideally, the only difference between the pre and the post-op pics is the change in anatomy from your operation. To best achieve this, I use completely manual settings on my camera and my flash, so the camera can't do anything. Specifically, I use a shutter speed of about 1/60th of a second, an f number of 9, ISO of 800, and on my flash, I power it to about 1/16th power. I don't think the color of the background is super important, but I do think it should not be exposed as much as the subject, because then the background itself can become distracting, particularly if it has wrinkles or creases in it. So here's an example of a patient who came to me for a rhinoplasty. She couldn't breathe well through her nose, and she also wanted the dorsum of her nose reduced slightly and the tip rotated upwards. And when you look at the pre and the post-op photos here, everything is pretty consistent with regards to exposure, positioning, and lighting. And as a result, when you look at the pictures, your attention is really drawn towards the surgical changes that occurred in the nose. And that's what we want with medical photography. We want the viewer's attention to be directed to the aspect of the face that we changed. And so you can see on the frontal view that her tip preoperatively was a little bit ptotic, and now it's been rotated upwards. And then on the profile view, she had a slight dorsal hump. And again, the tip was a little bit ptotic. We rotated the tip upwards and smoothed out that hump naturally. And so again, the consistency in lighting, consistency in positioning is critical. Here's an example of a series of photographs of one of my patients where I didn't do a very good job maintaining consistency from a photographic standpoint. So this patient came to see me after undergoing nasal surgery with a different surgeon. He also had a history of trauma. And if you look at the pre-op photos, you can see that on the frontal view, his nasal dorsum is depressed. And that's because on the profile view, he has what's called a saddle nose deformity. His nose is shaped like a horse's saddle. So I performed a revision rhinoplasty on him using his own rib cartilage to reconstruct his nose. And you can see that the result of the surgery is pretty good. On frontal view, his nose looks narrower. And on the side view, his saddle nose has been corrected, and he still maintains a natural masculine look to his nose. On the other hand, the photography in the situation was not so good. The positioning is off, the exposure is not consistent, and the background is really overexposed, particularly in the pre-op photos. You can also see that the background is wrinkled if you look carefully and creased, and all those things are really distracting. So again, to achieve consistency, try to use manual settings in your camera. So we talked a little bit about equipment. We talked about the importance of consistency. And now let's talk about how we can actually control the quantity and the type of light that enters your camera. There's three main ways we can do that. And there's three parameters, again, that we can change to change that quality and quantity of light. Those parameters are part of what we call the exposure triangle. And the parameters are aperture, shutter speed, and ISO. Aperture is defined as how much the diaphragm of the lens opens during a shot. That amount of opening is measured in what photographers call f-stops. It's a little bit counterintuitive, and you can look at this diagram down here for some guidance. But the lower the f number, the larger the opening in the aperture of the lens. So as you can imagine, if the aperture opening is large, the amount of light transmitted to the image sensor is also large. Conversely, if the f number is high, say f of 16, the aperture opening is very small, and the amount of light that gets to that sensor is a lot lower. And again, you can see that in this diagram illustrated here. Really importantly, aperture is also the main factor in determining depth of field of a photograph, which is the distance between the nearest and the farthest subjects in a photograph that are in focus. Higher f numbers increase our depth of field. Conversely, lower f numbers give you less depth of field. And I can show various examples, and we'll go through those in the next few slides of depth of field. This image of the moon was shot with an f number of about 5. And that's because in this image, depth of field was not that important. The moon is so far away from us that I don't really care if the closer aspects and the further aspects of the moon are in focus relative to one another. The whole moon itself is so far away that it really doesn't matter. Here's an example of how we can use aperture to our advantage. The aperture on this image was 2.8, which is a relatively low f number, meaning the aperture opens wide, allowing a lot of light into the lens and giving us a very shallow depth of field. As a result, your attention is brought to the eyes of the eagle and the eagle itself, and the background is blurred nicely so it's not distracting. This was taken in the Kenai Peninsula of Alaska, and there was quite a bit going on in the background. There's a nice body of water here. There's a lot of sand, and I didn't want that to distract from the actual eagle itself. So again, I used an f number that's low, 2.8, blurred the background. If I had used an f number that was higher, say 9, 10, 16, even 22, the image would look too busy and not have this three-dimensional effect to it. I hung around that beach for a while that day, and that same eagle took off after these seagulls started bothering it. And so I put my f number up to 3.2 because I wanted to, again, blur this background and keep the eagle itself in focus. Some of these seagulls you can see, like this one here, are slightly in focus, but again, the viewer's attention during this photograph is taken to the bald eagle, which is obviously the subject of the photo. Again, if I would have taken the f number up to, let's say, 16 or 22, all of this would have been in focus and the image would have been way too busy, distracting from the subject of the photo, which is the eagle. Here's an example of an image shot at an f number of 22. This is a waterfall in Girdwood, Alaska. And for this image, I wanted the entire foreground as well as the background to be in focus. So this log right here in the front of the waterfall is in focus, but this waterfall in the background, which was actually quite a bit further away, is also in focus. So f number of 22 keeps everything in focus. Here's another example of an f number of 22. This is Mesa Arch, and I wanted to keep this arch, which was right next to me, in sharp focus, but I also wanted this canyon in the background to be in sharp focus. And I also wanted these mountains to be in sharp focus. So f number of 22 gives me a wide depth of field. For my clinical photography, I try to keep the f number from around 9 to 12 to keep a decent depth of focus. And intraoperatively, I like to make sure that I keep the element that I see of most importance in focus and keep all the extraneous information out of focus so the patient knows exactly where to look when I show them pictures. For instance, this patient came to see me and wanted more symmetry to the base of her nose. You can see on frontal view that her left nostril is a little bit asymmetric compared with the right. That's more apparent on the base view. And the tip of her nose is also deviated a little bit to the left. So I created a shallow depth of field intraoperatively by keeping my f number really low. In this example, it's at 2.8. And I focused in on the base of her nose. So this is right after her operation was done. You can see I sutured up the columella. The nostrils are now symmetric and the tip is in the midline, but I blurred out the eyes purposefully because I wanted her to look at just the base of the nose and not have her attention distracted by the outside parts of her face and the eyes. So again, F number 2.8. Here's her pre and her post-op pics, again, taken at F number of 9. And you can see pre-op, again, her nostrils are asymmetric on frontal view, and post-operatively, they're more symmetric. And her tip post-operatively is in the midline, whereas pre-operatively, it was deviated to the left. So that's aperture. The next parameter we can control in our camera is shutter speed. And that's how long the actual image sensor is exposed to light. And that's measured in seconds or fractions thereof. The lower the number, the faster the shutter speed and the less amount of light that gets into your camera. A faster shutter speed also results in less camera shake and captures action better. A slow shutter speed, on the other hand, shows movement. This photo of a bald eagle in flight I took with a shutter speed of 1/1600th of a second because I wanted to freeze the action and I wanted the wings and the entire eagle to be totally frozen in detail without any blur. And so when you're taking a photograph without a tripod, a general rule is that your shutter speed should be at least as fast as 1 divided by your focal length. So for instance, if you're using a 200 millimeter lens, your shutter speed should be about 1/200th of a second or faster. That avoids blurring of the image from unstable hands. And if you have vibration reduction built into your lens or your camera body, you can use even slightly slower speeds. When you want to freeze motion, like we did with that eagle picture, you use a fast shutter speed. The image of this wave taken on the North Shore of Oahu, I shot at 1/4000th of a second. And because of that fast shutter speed, you can see that the action is frozen in time. And you can even see the droplets of water frozen in movement, and there's no blur to this image. On the other hand, here's an example of a slow shutter speed. I took this image of sunset in Maui at 30 seconds exposure on a tripod, and you can see that the clouds show motion, they're blurred. If you look carefully at the palm trees, you can see that they're blurred, and the water achieves this kind of impression of being glass, which I kind of like to do sometimes with water. So that's a 30-second exposure. Here's another example of a very slow shutter speed to capture the movement in the aurora borealis. Things that aren't moving are still and they don't blur, like this church here. But the aurora itself, the movement has been captured, and that's why it's kind of blurry or smooth. Another example of a slow shutter speed. This is a 20-second shutter speed taken at Lake Louise in Alberta, Canada. Again, I've tried to achieve that glassy appearance to the lake water, and I've blurred the clouds to show that they're moving towards me. But all the stuff that's not moving, like the rocks here and the mountains, remain sharp. So that's shutter speed. And the last parameter that we can adjust in our camera is the ISO, which is defined as the sensitivity of the image sensor to light. And the lower number on your ISO, the more light that's required for a proper exposure. So for instance, with the ISO of 100, you're going to need a lot of light to get to your camera to achieve the proper exposure. A higher ISO number, on the other hand, means that less light is required for proper exposure, but you're going to get a lot more noise in your image. So this is a photograph I took of my daughter. In this image, I had a tripod, I had plenty of light, and so I wanted less noise because I wanted to be able to enlarge this image and have it look nice in a frame. And so I set the ISO as low as I possibly could, in this case to 100. On the other hand, here's an example of where you need to use a high ISO. This is the galactic center of the Milky Way seen from Mauna Kea in Hawaii. And for this image, I had to use an ISO of 800 to increase the sensitivity of the image sensor to light. This light is coming from light years away, and it's very faint. And so to capture it, we need our image sensor to be very sensitive. But as a result, I paid a penalty. And the penalty that you see is the noise in the image. And if you zoom in on this image, you'll see that it is actually quite noisy. And if you blow this up, it looks fine, but it's not going to look as good, as crisp as that image of my daughter in the previous slide. So this is ISO of 800. In the middle, here's an example of ISO of 200. This is the Aurora Borealis outside of Anchorage. This was taken from about 3,000 feet elevation. Because the snow was out and the moon was out, I had a nice foreground that was lit reasonably well. The aurora was pretty bright that night, so I could set the ISO down to 200. And this image is not nearly as grainy as the previous one of the Milky Way. In facial plastic surgery photography, I think kicking up the ISO is a great way to increase the amount of light in your photos. I generally will shoot my images with about ISO of 800. And this is an image we saw earlier of one of my patients with an ISO of 800. And in my opinion, this is a totally usable photo for surgical purposes. And I think that the graininess you see in this photo, is negligible. And I honestly can't even see it. On modern cameras, you can put the ISO up to the thousands to really take advantage of the light that you have available to you. So again, we talked about the basic concepts that drive how we alter the amount and the quality of light that enters our camera. Those parameters are aperture, shutter speed, and ISO. You can apply these concepts to medical photography and to your wildlife or your portrait or your landscape photography equally well. Again, this is just the tip of the iceberg when it comes to photography, and there's a whole lot more to talk about and learn. And I hope you enjoyed the talk. If you have any questions or comments or want to request an appointment for facial plastic surgery, my clinic phone number is here. My email is listed here as well. My photography website is pbaumaphotography.com, and my practice website is also listed here, washingtonplasticsurge.com. Thank you again for your attention, and happy to chat at any time.